we looked at these arrangements among the main global operators of the terminals, as well as some national operators, and we try to look at them across a range of countries and terminals to include countries that, rich countries with quite highly developed infrastructures, and then poorer countries where there are terminals, but where perhaps the context in which health and safety is managed is quite different. There are global practices that are not identical but similar, that are rolled out by the big terminal operators at the international level. However, when these practices are implemented in ports in different countries, you see very different outcomes, which I think has a lot to do with the context, the national context in which they are implemented. We also found a considerable gap between what managers felt was happening in terms of safety management systems in place and what the workers' experiences were of their own health and safety in those workplaces, and we concluded that there were very strong employment and work organizational effects that created those differences. In particular, we found the increasing use of contractors and contract labor to be responsible for quite different measures of health and safety outcomes between the directly employed workforce and the contract workforce. There's lots of things that emerge from the research that would be worth exploring further. Particularly, I think the question of having common strategies on amongst the main players in terms of container terminal operation is very important, and I think international bodies as well as the global terminal operators themselves could be making some significant improvements in the way they communicate with each other and the way in which they implement the common strategies that they could develop. There are many manifestations of good practice in the industry as a whole, but I suppose a key message is that there needs to be more kind of common understanding of what good practice actually consists of, more evidence, good evidence for the outcomes that it can produce, and better arrangements for leadership of risk management more generally in the industry. Those would be some of the key ways forward. And then the other key issue that emerged from the study was the huge variation in the extent to which workers and their representatives were involved in the arrangements in the industry. And I think that again, there are examples of very good practice, but there are also many areas where practice is almost non-existent in that respect, and huge room for improvement.